Spongeless Net Application and Long-Term Monitoring. After applying the net to the patient, you must now fill each pedestal with electrode gel. Fill a provided syringe from the net support kit half full with the electrode gel. Locate the reference sensor and move it in a side-to-side motion to part the hair. Gently turn over the reference sensor and fill the spongeless chamber with the electrode gel. Carefully turn the pedestal upright on the head, making sure the sensor is resting on the scalp, not the hair. Repeat these steps with the common sensor, then with all of the sensors in numerical order, refilling the syringe when needed. Head wrapping. Head wrapping is done to improve the quality of long-term EEG monitoring and recording. Head wrapping is especially useful for maintaining sensor contact while the patient is sleeping or wearing the net in a recumbent position. For head wrapping, use 3 1-inch rolls of stretch gauze. Stretch gauze will work better than regular gauze at holding the net in place. Use half-inch tape that is easily tearable. Prior to application, make a couple pieces of tape for use during the wrap. When wrapping the head, you want to pull the back part of the net in towards the head. You also want to make sure the reference and the common are held in place throughout the recording. Start at the base of the head. Come up across the forehead, making sure to keep eyes free from the gauze, and then continue wrapping across the back. After the first good solid wrap, focus on covering the electrodes to make sure they don't catch on anything. Place tape over the end, remembering that the fold makes it easy to pull off. The second piece of gauze focuses on holding down the reference and the common. Start by wrapping underneath the chin. On some patients, the cord locks get underneath the gauze, which may be uncomfortable. One trick is to avoid this by twisting the gauze roll and avoid the cord locks, but still be able to come up to a wide piece at the top. Make sure the patient can still open his or her mouth and breathe. The first wrap made sure to go across the vertex. For the second and other wraps, make sure to go across the common, covering the last remaining portion so it doesn't catch on anything, and then tape the end piece down. Depending on the size of the head, this may be enough with 2 pieces of gauze. Depending on how active the patient is during sleep, you may consider placing another piece of tape around the circumference of the head to hold down your 2 pieces of tape. Double check with the patient to make sure he or she can still open his or her mouth, chew and swallow, and that nothing is hurting the chin. Depending on the patient, the gauze may be riding over the cord lock and may become annoying. So move the gauze up and off the cord lock. Make sure to reseat the face electrodes if they become too loose. If the gauze is too tight at night, you can readjust it. If the gauze is too loose, then you can rewrap it. To remove the gauze, start with the main straps over the top of the head. Untape the last piece done and start to unwrap. Repeat with the other piece of gauze. With long-term monitoring, you may see deep red impressions left on the skin after net removal. These marks may last several hours or even days. It is important to practice informed consent with the patient before long-term monitoring to address the risks of skin irritation or skin damage.